is that our children have had their learning paralyzed due to the different measures that we've put in place. However, it is to remind each and every one of us that some of these measures were actually necessary and quite important. One, in enabling us to be here together today as a community in Kiambu, knowing that we have been able to actually start mitigating against COVID-19 and we have started flattening the curve. It is important to remember, even as we get into this new normal, 8 months in, the three measures continue going forward. And I'm happy today the governor was able to remind us of how to wash our hands, the 10 steps of washing your hands with soap and water, wearing of masks at all times in public places, which remains crucial, and then finding ways of which you can maintain social and physical distancing, even as we resume work and we resume the new normal in our country. And so we continue to remind you, really, and the DJ has done an excellent job today sharing with you the management of COVID, what it looks like when it comes to the vaccines. And so we remind you that there is no cure for this disease. And yes, studies are being carried out the world over to be able to determine if we can find a cure, and also to be able to find a vaccine that can offer us, a new way of living while controlling this pandemic. But the important message becomes that really, this condition is still here with us. While gains have been made, we have to ensure that we avoid going back, we avoid getting a second wave. And so it's for this reason today we really appreciate the engagement of all the community leaders present here today, noting really the contributions of the business community, noting the contributions of our community health volunteers and workers, who really, we have to celebrate Kiambu, one, for recognizing them as a part of your workforce, and two, for facilitating them with the different kits that they require. Because really, as a Ministry of Health, we do believe that community health workers do form the base platform of achieving the UHC dream. And so, with regards to the continued measures, the National Emergency Response Committee continues to meet, continues to deliberate on what the new normal will be. And really an important milestone is this coming Monday. His Excellency, the President Uhuru Kenyatta, shall chair the COVID-19 conference that will serve as a platform of reflection of the past 8 months as a country, the lessons that we've learned, the needed investments in the health sector, and how to then settle into a new normal as a country. With regards to our COVID-19 situation, in terms of our statistics today, 141 people have tested positive from a sample size of 3,307 tested in the last 24 hours. This therefore brings the total number of COVID cases in the country to 37,489 cases. Out of all these cases, all are Kenyan except 7 who are foreigners. And in terms of disaggregation by gender, we have 103 males and 38 females. And in terms of age, the youngest is a 4-year-old child, while the oldest is 74. When we look at the disaggregation by county, we have today Trans Nzoia leading for the first time with 28 cases, Nakuru with 24, Nairobi with 14, Mombasa with 14, Kiambu with 9, Migori 8, Kisumu and Kajiado both have 6 cases, Uasin Gishu, Narok, Kitui, Turkana have 5 cases, Bungoma have 2, Homa Bay, West Pokot, Machakos all have 2 cases, whereas Murang'a, Nandi, Vihiga, Meru and Busia have 1 case. We continue to provide you with the disaggregation by county, and particularly because today we're in Kiambu County, I'll focus on that. Of the 9 cases in Kiambu, we have 5 from Thika, Kiamba and Kiambu Town having 2 cases each. When we look at our recoveries, on a positive note, 81 people have recovered from the disease, 69 have been discharged from various hospitals, whereas 12 have been discharged from the home-based care program. And so as a country, our total recoveries stand at 24,334, approximately having about 65% recoveries. And we really thank our healthcare workers for their continued dedication to duty. I do thank the community today that has especially appreciated the role that healthcare workers have played. And I wouldn't have said it any better than perhaps the MD from Broadway, who notes that we've long ignored our healthcare workers. We've long neglected them, but really COVID-19, the silver lining has been the appreciation of what it means to be a doctor, to be a nurse, to be a lab technician, and so we continue to thank you all for your dedication to duty. However, on a sad note, today 5 patients succumbed to the disease, bringing the total fatality to 669, and we pass our sincere condolences to the families and friends of those who've lost their loved ones. I think at this point we do welcome a Q&A session.
I'm not in the media. My name is...
Fantastic.
Thank you very much. My question is very simple. Recently, I had the opportunity to check all the patients in my ward to do a test for COVID. If we can do that within 24 hours, is there a possibility that we could have the opportunity to do that to all our healthcare workers?
Thank you for your question. Is there any other question? Well, that sounds like a DG question, but I'll give it a stab. Governor Nyoro, we're always happy when we have the DG here because he takes that for us. What you raise is really important and fundamental, and it is the issue of our testing strategy. And it is, a question that is trying to find out if we went and tested everyone in the ward, if I'm correct in terms of your question, what would be the value of doing that? I think one of the key things that we've learned, and really one of the big reflections we'll be sharing on Monday during the conference, is that testing has come about with various challenges. Challenges due to supply chain disruptions, challenges due to, elements of monopoly when it comes to who is making these kits across the world, challenges when it comes to even being able to adequately deploy all our lab technicians to be able to serve COVID-19, do the testing and get it back to us on time, but also to be able to deal with all these other disease conditions. And so what happened in the beginning of COVID, and this is really an important story, when COVID began, as a country, as a sector in the Ministry of Health, we purposed to ensure that our testing capacity was able to test each and every case. If you remember, we started with a test, isolate, treat, and trace approach for COVID-19. And soon, in the response, we noticed that there were challenges. There were challenges when it came to not only having the kits, but even having the swabs, the components that you need to be able to do a proper test. And so, interestingly, this was the same situation the world over. And there have been conversations at WHO, conversations at Africa CDC. Really, what does it mean to be able to have a testing strategy that works for the country? A testing strategy that is able to meet the objective of ensuring that the system is continuing on as we contain the pandemic. And so as it stands, and DG will really pick up from here, is that it has been proven to be irrational deployment of resources to test everyone, particularly because we've said, and today DG reminds us, 93% of us are asymptomatic. What it means is that in this crowd that we have here in front of us, 93% of us could be here having COVID-19, but we are asymptomatic. So every time you have a limited number of resources, you have to deploy those resources in a rational manner. And that is one of the reasons why we will not be testing everyone in our ward. The second one is of how COVID is as a disease. I could test you today, you're negative, but then you go in and you meet someone and you turn positive. So then it defeats the purpose of that. However, we have a new testing strategy, and that is what the DG will share with you. Who are we prioritizing when it comes to testing? How will testing look like 2 months from now, 3 months from now, 6 months from now? And what are the new tests that are now in the field? We now have antigen tests and antibody tests that are much cheaper, that will perhaps change how our testing strategy has been. So maybe DG, you can take it over from here.
Thank you, Madam. Yes, now that the media didn't have questions, we'll probably go beyond the question that was asked by Dr. Probably I would start by where we were, based on what our projections were. Remember when we reported the first case of COVID-19 on 13th of March, we had a scientist in the Ministry of Health working together with other scientists from our universities, the research institutions, give a new highlight of what we think the situation would be. And if you look at the pattern of evolution of the pandemic, it has gone exactly according to script as predicted by your scientists. So number one, trust your scientists, trust your doctors, trust your lab people, trust your nurses, that all we do, we mean well for this country, and we'll always stand with science and stand for the truth. Because of that, we advise His Excellency the President on the measures to undertake, and those measures, initially based on our projection, we predicted in the worst case scenario that we are going to lose 5,000 people by the end of this year. Madam CS has just highlighted the numbers for today. We are still below 700. So as a result of those containment measures and the other interventions we have put in place, we have saved more than 4,400 lives. That works to about 86% of mortalities averted. Number two, in terms of our testing strategy, initially we had what we call mass testing, where we just walk around and anybody who comes for testing would be able to swab their nose and their throat. But based on emerging evidence, that was not making business sense. More so what Madam CS has stated was the global supply chain constraints in terms of the testing kits. So we were not the only country, including the great countries of this world, including the Americas, had to go back to the drawing board to be able to do a new testing strategy. And that is what we are now implementing, and therefore we are trying to focus on those who are symptomatic. That is why we are doing the clinical surveillance in all our facilities. Those who present with severe acute respiratory illnesses are the people that we prioritize. We prioritize the healthcare workers because by the nature of their work, they stand a high risk of getting COVID-19 infection. We prioritize people who are in places like in prisons because you cannot be able to maintain physical and social distance in such a setting. And also, if you look at the infection or water sanitation and hygiene measures in prisons, it's very, very difficult to maintain a high standard of hygiene. So going forward, we are looking at the people who are symptomatic, plus their contacts, the healthcare workers, people in the transport sector because they interact with very many people, people in the prisons, and we have a guideline to be able to assist us that way. That way we make prudent resource of this use of this scarce resource, and therefore we get the desired results. So we are implementing a new testing strategy, and we have also looked at very many other parameters, including what we recently launched, our burial protocols, based on emerging evidence, which is now also locally generated. Remember, in the initial phase of the disease, we used to rely on data from outside. But now, even if you talk to our doctors here, they'll be able to tell you that there are certain measures that they can be able to deploy in management of COVID-19 cases with very, very good results. So this has also enabled us now to develop homegrown solutions in management of COVID-19 disease. I would want to once again repeat on the flattening of the curve that we are making good progress. We are past the inflection point of the curve, so we are now on a downward trajectory, but we don't need to drop the ball. We need to continue holding hands together, maintain public social health measures, infection prevention control measures, so that we can comfortably say that we have flattened the curve. Today our positivity rate was about 4.3%, and if you look at the past 3 weeks, we have maintained a rate of less than 5%. And going forward, we believe it will come to even a lower figure. And we have fewer and fewer cases in the facilities. Like Excellency Governor said, this beautiful facility, there's nobody with COVID-19. We have lower and lower mortalities. Our case fatality rate still stands at about 1.7, 1.8%, compared to a global average of about 3.1%. Of course, we have had infections in healthcare workers, more than about 954, and out of these, 495 are males. They constitute 2.6% of the total caseload of COVID-19, and we have lost 16 healthcare workers. That works about 1.7% case fatality ratio, again, which compares very favorably with the global case fatality ratio for the general population. a lot of work is going on vaccine development, as we said when we were doing the BCC. And we are part of this vaccine development through our premier research institution, KEMRI, working with our team in Kilifi, KEMRI Wellcome Trust, and particularly with the Oxford vaccine, which is now in phase 3 trial. Phase 3 means you are administering the vaccine to a larger population, and you are trying to look basically at the efficacy, whether the vaccine is eliciting the proper response that you anticipate, and also, of course, looking at the safety. It is important that we are part of this journey because, one, we have local data for our own information. Number two, when this vaccine comes out and it works well, we will be at the front line in receiving the vaccine. And of course, number three, why it is important to do that is to ensure that sometimes you develop medicines, they may work in a particular setup and not in a particular setup. So when we develop this and we are part of that development, if it works for our people, we surely know that it's going to work for our entire population. And together with that, there's also what we call the COVID vaccine facility, which is a global alliance of countries coming together for the first time. Even the first world countries are joining hands with the low middle income countries and also the lower middle income countries to be able to put resources together to develop a vaccine. I told you it takes about 7 to 20 years ordinarily to be able to develop a vaccine. We want to do this in less than 1 year. How best can we do it? By joining hands, pulling our resources together, spreading the risk. And with that, there's something that we call at-risk manufacture, such that this resource that we get, we can be able to distribute to various manufacturers. If it does not work, the global community loses very little money, rather than go it alone. So the charmer in us as Kenyans is also working out in the development of the vaccine. And finally, our doctors, our nurses, our clinical officers, the entire 17 cadres of our healthcare workers are working very, very hard, using locally generated information to be able to provide better management of COVID-19 cases. And we believe the platform that we have set aside for COVID-19 will be a big stepping stone for us in our journey towards universal health coverage. Asanteni.
Thank you all. Thank you.